Ectopic pregnancy. These two words can be scary, especially if you're trying to conceive. But knowledge is power, and understanding this condition is the first step towards getting the right care and support. In simple terms, an ectopic pregnancy occurs when a fertilized egg implants outside the uterus, most commonly in the fallopian tube. This is different from a typical pregnancy where the egg implants inside the uterus. The fallopian tube, unfortunately, isn't designed to support a growing embryo. If left untreated, an ectopic pregnancy can pose serious risks to your health. That's why it's crucial to be aware of this condition, recognize its symptoms, and seek medical help immediately if you suspect anything is amiss. Remember, early detection is key to ensuring your well-being. Ectopic pregnancies aren't as uncommon as you might think, affecting about 1 in 50 pregnancies. But what causes this to happen? Several factors can increase your risk. These include a history of pelvic inflammatory disease, or PID, previous ectopic pregnancy, endometriosis, or certain fertility treatments. Sometimes smoking, age, over 35, or having an IUD for contraception can also play a role. However, it's important to remember that an ectopic pregnancy can happen to anyone, even if you don't have any of these risk factors. The exact cause isn't always clear, and it can be frustrating not having all the answers. However, understanding these potential risk factors can empower you to be more proactive about your reproductive health. Early detection is crucial when it comes to ectopic pregnancy. Being aware of the symptoms can make all the difference. The most common sign is abnormal vaginal bleeding. This bleeding might be lighter or heavier than your usual period and may be accompanied by abdominal pain or cramping. The pain can be sharp or dull, constant or intermittent, and may be located on one side of your abdomen. Other symptoms include dizziness, weakness, nausea, or pain in your shoulder, neck, or rectum. It's important to remember that these symptoms can mimic other conditions, like a urinary tract infection or even a normal period. However, if you're experiencing any of these symptoms, especially if you suspect you might be pregnant, it's crucial to contact your healthcare provider immediately. Section 4. Seeking help, your first steps. If you suspect an ectopic pregnancy, don't hesitate to seek medical help. Your doctor will perform a physical exam and order tests, including a blood test and a transvaginal ultrasound, to confirm the diagnosis. The blood test checks for the pregnancy hormone HCG, which is typically lower in an ectopic pregnancy. The ultrasound helps visualize the location of the pregnancy. Early diagnosis is essential because prompt treatment can prevent serious complications. Treatment options typically involve medication or surgery, depending on the stage and location of the ectopic pregnancy. Remember, you are not alone in this. Your healthcare provider is there to guide you through every step of the way, providing the necessary support and care. Section 5. Navigating the emotional roller coaster. Experiencing an ectopic pregnancy can be emotionally challenging. You may feel a mix of emotions: shock, fear, sadness, grief, and even guilt. It's important to acknowledge these feelings and allow yourself to grieve the loss of the pregnancy. Don't be afraid to reach out for support from loved ones, a therapist, or a support group. Remember that an ectopic pregnancy is not your fault. It's a health condition, and blaming yourself will only add to the emotional burden. Healing takes time, both physically and emotionally. Be patient with yourself, and remember that you are strong and resilient. Section 6. Finding support and hope. While an ectopic pregnancy can be a difficult experience, it's important to remember that there is hope for the future. Many women who experience an ectopic pregnancy go on to have healthy pregnancies later. Your healthcare provider can discuss your individual risks and options for future family planning. In the meantime, focus on taking care of yourself, physically, emotionally, and mentally. Surround yourself with supportive people, engage in activities that bring you joy, and allow yourself time to heal. Remember, you are not alone. There are resources available to support you through this journey. Organizations like the American Pregnancy Association and Resolve. The National Infertility Association offer valuable information, support groups, and resources for those who have experienced ectopic pregnancy.